I'm Annie Gunner-Logan. I'm the Chief Executive of the Coalition of Care and Support Providers in Scotland, and we bring together all of the third sector or voluntary sector support providers in social care in Scotland.
And I'm Sandy Cameron, and in a past life I was a Director of Social Work for 20 years in Scottish local authorities, and I now chair a number of social care organisations in the third sector. So I've been involved in this for about 50 years now, and I have to say this is the most dramatic change to the way that we work that in that time I've had experience of, and I'm sure the same is true for you, Annie.
Yes, I think so. It's one of those moments in history, isn't it, really? And social care, we kind of find ourselves absolutely in the eye of the storm, as it were. Obviously, there are some really, really big challenges around that, but I think we're also learning a lot as well about how we can manage and organise and deliver social care in the future.
Yes, I think there are a lot of things that we're now of necessity having to do very quickly within the past few weeks that we'll reflect on and think, well, maybe this is a better way of doing things. And certainly what has been striking is how we have been able to solve some problems very quickly, despite the difficulties that there have been, and there were always going to be difficulties. But I think from my point of view, what's happened is that this has, I think, increased awareness of how big and how important the social care sector is in terms of the care of a whole range of people in our population.
Yes, and I think some other things are coming to more public awareness as well, perhaps, than there were before. Certainly there has always been a little bit of a sense that social care is in some ways the sort of junior partner, if you like, in health and social care. And I think we're all realising that that's not quite right. At this point, we're coming to that realization quite quickly, I think. And I also think that it's not necessarily obvious to everybody the way in which social care is organized and the way in which, in effect, it operates as a market where there are hundreds of different providers and hundreds of different employers. Not just the direct delivery by local authorities and health and social care partnerships. In fact, that's the minority. It's only about 20% of social care is delivered directly by public bodies. And I think during the process of health and social care integration in Scotland, that people are becoming more aware of that. But now I think people have really, really caught up. And we are seeing some of the challenges of that coming out in this crisis in a way that we might not have done previously, I think.
Yes, I think that what I hope people will begin to grasp is the importance of sustaining that huge diversity of organisations, because if we don't have them, then our society frankly can't work and the health service will be overwhelmed with demand. I think the other thing that strikes me is at the present time, the focus understandably tends to be on care homes for older people. And of course there are concerns there. But equally, we shouldn't be surprised that they are very badly hit because of the nature of their residents. But the sector is much wider than that. I chair an organisation that looks after people with severe disabilities. I chair an organisation that looks after people who have got issues with drug misuse and offending, who are veterans coming out of the services with problems. And I'm also involved in a company which provides residential childcare and fostering services. So there's a big diversity, all of which have got their own challenges with COVID-19 to deal with.
Yes, I agree with that. I mean, the main focus right now is on older people's care homes, and that's quite right, because that's where some of the really major risks are emerging. But let's not forget that there are other social care settings where communal living is a feature. So, you know, for younger disabled people, for people with severe cognitive impairment, children's homes, for example. You know, there are lots of places where people live together in care settings, and whilst the focus is on care homes for older people because of particular risks and vulnerabilities there, some of the same issues around, you know, PPE and testing and the importance of good guidance kind of covers right, all of those services. And then particularly for our membership, I think there is the question of how we manage visiting services that people receive in their own homes.
Yes.
So home care, supported living, housing support, support for children and families at risk. Now, they're not the same risks as care homes where many people are all gathered together, but there are similar risks in the sense that these are the same workforce that is visiting several people over the course of a day in their own home. So they're kind of going from one person to another, and that raises some of the same issues around PPE and testing and so on. And then there are kind of parts of the system that we probably wouldn't be that visible, I think, a lot of the time, like social workers carrying out child protection visits. You actually have to go into somebody's home to do that a lot of the time. Same for all kinds of visiting support and personal care that disabled people rely on. And as you say, Sandy, there's third sector organisations involved in supporting people who are homeless, who come out of prison, who have severe mental health problems. I mean, it's absolutely huge. The diversity of services in social care that are pretty much alive to this issue now and really trying to manage it in the best way that they can.
I think what we've had to do is stop quite a lot of the face-to-face services, but as you say, there are services that you can't do that in. You can't keep vulnerable children safe unless you actually get through the door. So the people who are doing that, the social workers, need to have the right equipment and need to have the discretion and the authority to take their decisions about how best to handle the situation. And that, I think, is happening around the country. But equally interestingly, we are learning that we can support and sustain contact with people in other ways. So one of the issues that we're finding with women coming out of prison, for instance, is that the mentoring services are making a great deal of use of telephone contact. And women are, in effect, looking for support 24 hours a day. In Scotland, we are about to have quite a large release of people out of prisons to relieve that pressure. And SACRO, an organisation I chair, will be supporting them through one of our projects with other partners called Shine. And one of the things we're doing is making sure that every woman who comes out of prison has got a phone so that they can be supported and find their way back into the community. So there are new ways that we're managing to find to support people. But they don't all replace the need for face-to-face contact.
Well, face-to-face contact is very important when you think of the growing research where we know about the risks of social isolation for people. So obviously there are some services where you just have to show up. I mean, if you're providing intimate personal care to people, you're not going to do that over the phone or over the video. But even where there is visiting support without intimate personal care, so it's that kind of human contact that is really, really valuable. So I think there are a lot of organizations now being very creative about how they approach that, and in the same way that GPs are really kind of now beginning to fast stream the video consultations. You've got in our world, you've got a lot of mental health organizations who are working digitally, who are working on the phone, who are finding ways to keep that essential contact with people. And all the more important really when things like day centers really are kind of just not happening anymore, again because of the kind of congregational nature of the service. There's just too much risk there. So there's a lot of creativity going on there, and I think in some ways we're all saying this now, aren't we, that there will be a new normal when we come out the other side of this. And I think that might be one of the ways in which we approach the new normal, is that we'll just be doing things very differently where it has been shown that it can work and it can be just as effective.
Yes, I think one of the things that I've been in discussion over the past couple of days with various organisations about is the need to be reflecting on how we are currently doing things with a view to saying what's worked here and should we continue to do that in the new normal as you describe it, and equally what are the things that have not worked very well. And without any doubt there will be those things that have had unfortunate consequences, but potentially we didn't have any choice in the current situation. One of my concerns is because we are shutting down, or we have shut down day services, day centres, is to be sure that we maintain contact with people and their families, to be sure that they are being supported. And I can think of at least one example of a young person where we have reopened a facility to provide relief for the family because they simply weren't coping. So I think being fleet of foot and being prepared to change what we're doing is important if we're really to sustain some very vulnerable people in their own homes.
Yeah, I agree with that. The kind of models of service delivery are going to change, but I think also the way we structure service delivery and the way we structure the organisation of planning and delivering social care is also seeing quite a lot of changes that I think some of us would quite like to keep after this. You know, it's happening in the emergency, but there are some things that we really, really want to hang on to. I mean, when you think of the social care proposition, it's actually quite simple. You know, here are some people who need some support to carry on living their daily lives and acting as citizens over here. And then over the other side, there are some people who want to help them do that. Right? So it's pretty basic, okay? And on top of that, we have created this kind of Byzantine system of legislative and regulatory architecture, some of which is now being dismantled, and we are now kind of thinking, well, did we actually need it? I mean, one good example of that would be, I mean, Sandy, you know very well that I've been talking for years and years about, you know, how unnecessary competition and tendering is in social care. And what we're finding now is because people are way too busy to do any of that now because of the crisis, then suddenly it doesn't become necessary anymore. And I kind of think, well, if it's not necessary now, maybe it won't be necessary afterwards. I mean, we're seeing things like PVG checks speeded up beyond all our imagining. We never thought this would be possible in the past, and suddenly it is. So there are all kinds of things that are happening here that I think we could learn from. And one of the most important for me is the recognition of the importance of this workforce and the need to reward them appropriately.
Yeah, I think that's really important. And the workforce in social care, certainly in my experience, have been absolutely committed to being at their work as far as they can. We've had real commitment from people in some very difficult situations. But I think that also is an indicator of employers doing a lot to be sure that they communicate with staff and that we are hearing their issues and looking to respond to them. Of course, there have been difficult issues, and you've been very heavily involved in them in the past few weeks, trying to sort out guidance and PPE and what have you. As that begins to settle down, as I think it is, then it's time, as you say, to look at saying, well, we've been able to solve these problems very quickly. My goodness, we've cleared a lot of hospital beds in a very short period of time. How has that happened? We need to look, of course, at have people suffered as a result of that, but equally, what has it been that's enabled us to cut through some of the bureaucracy that often goes around it or the difficulties? And I think over the past few decades, to be honest, what we've done is we've had a tendency to put structural solutions into perceived problems as opposed to behavioural solutions. The behavioural solution being, we can sort this, let's just do it. And I think of necessity that's had to happen in the past 4 or 5 weeks, but to some significant benefit, I think.
Yeah, no, I agree. I mean, my organisation was initially very much focused on policy and legislative change. You know, if only the law would say the right thing, and if only the guidance would say the right thing, and if only we got the right wording and the right policy, everything would be all right. Well, you know, guess what? We did all of that. And actually, it didn't make a huge difference because, as you say, Sandy, it's all about kind of attitudes and behaviours and approaches and culture. And we're finding now that, you know, I think it was Warren Buffett, wasn't it, who said it's only when the tide goes out that you find out who's been swimming naked. And you find that where employers in social care have been investing in their workforce, where they have been communicating appropriately, where they have been adopting fair work principles and so on, then actually they are now more resilient. And I think that's a really good learning point for all of us. I guess one of the challenges we've got is in social care, given that it has been kind of fairly undervalued and under-resourced in the third sector, is we hope that we will still be here after this crisis in order to do all of this learning, because the sustainability of organisations through this, I think, is going to be quite a challenge.
I think that is a very serious concern. We know that the economic situation is going to be extremely difficult.
Yeah.
But equally, we know now more widely of the importance of these social care services working alongside colleagues in the health service and other sectors. And if they're not there, then we need to be really worried about what's going to happen to many people in our communities. So this is a big challenge for us as citizens and as government, both central and local government, about how do we make sure that these services continue to be there and viable.
And I think it's kind of underpinning or indeed overriding all of that is what we are learning about the people who rely on social care and support. Because these are, by and large, the people about whom a discussion is being had in some quarters about whether their lives are actually worth saving, and people who are being asked to look at, DNR certification just now out of the blue, has never happened before. And some of those are younger disabled adults, some of those are older people, some of those are people with significant impairments. And I think it has actually come as quite a shock to some of us, the extent to which there is sort of assumptions being made about the quality of their lives. And these are precisely the people who are the concern of social care organisations. That's where we are. Our entire focus is around those people. So to get their visibility in all of this, I think, is really, really critical. Not just the visibility of the organisations that support them.
Yes, I think those of us who are involved in this need to be very alert to that issue and to be very willing to fight the corner of people. I worry when I hear, albeit that it hasn't actually come to fruition as yet, as far as I can see, but the potential for whole categories of people to be excluded from going to a hospital, because the underlying bit of that is worryingly almost as if they're not worth it. And that's a terrible situation. Now, I don't think we've actually seen that, perhaps because the most severe pressure has not been on ICU and all the rest that it might have been. But nonetheless, that thinking is worrying, as opposed to understanding the very real problems for people who get this illness. And one of my concerns working with people with severe disabilities who may have very significant communication problems is that they become ill, an ambulance is called, no one's allowed to go with them, they're taken to hospital, nobody can communicate with them. How terrifying must that be for people? Now, we've tried to make sure that all of our service users, all of our customers have got their health passports with them that tell about that. But there is an issue in this now that we need to be thoughtful about what the impact on people with learning disabilities or communication problems of any sort when they have to go to a hospital in these very dire circumstances.
Yeah, and I think some of these problems have been around for a while,
yes.
And we are finding now that they are being amplified very, very significantly and rapidly. So again, there's I find myself talking with my colleagues a lot about the recovery.
Yeah.
When we recover from this and the learning that we're going to take from it, and certainly the kinds of issues you've just been raising there would be kind of fairly close to the top of the list, I would think.
Yes, because as you say, these are not new problems, but they are thrown into stark relief in this because of the urgency of the situation. And the problem also is that the way that people are responded to varies quite widely across the country, varies within health authority areas in terms of whether carers are allowed to go, whether local authorities will fund that. But we need to be thoughtful about what the hospitalisation in these very serious circumstances is in terms of the experience of people who will find it difficult to understand what's happening to them.
Yeah. And, in that context, I think it's kind of important to revisit some of what we've already said in this conversation about the workforce. Because I don't necessarily buy into the narrative that says social care is in crisis, it's close to collapse, everybody's going to leave and go and work for Tesco. I mean, we know that there are big issues here, and we know certainly that the reward, that financial reward in the terms and conditions that social care workers receive is not as good as it should be. But I think we have to acknowledge that we've got 200,000 people working in social care, and the vast majority of them absolutely love their job. They are rising to the occasion. This is what they have trained for. I think we can feel very proud of them and what they are doing. And when we get to the end of it, we need to address some of the challenges we've had in relation to how we value them.
Yes, I think that's been one of the things that has been thrown up, is how important a job it is that people who across the board are not very well paid do. So we need to be looking at how that can be enhanced. We certainly need to look at how their training can be enhanced. And through this, we need to be sure that they feel confident that they have got access to the right guidance in understandable forums, that it doesn't get changed every other day, and that they've got access to the equipment that they need to do their job safely. So that's been a bit of a struggle in these early weeks. But notwithstanding that, everyone that I hear of has stuck with it and done their very best to support the people that they work with, not least of all because they like them and they care for them.
Yeah, absolutely. Just a note on the guidance. You're absolutely right. It's not been plain sailing these last few weeks. Really, it's been a little bit bumpy. With different versions of guidance coming out and then it changing again, and that kind of injects an element of instability and uncertainty.
Yes.
For the workforce, which is really, really unhelpful, because people, if we're going to ask people to put themselves at risk, which is in effect what we're doing here, then we need to be pretty solid in our support for them. I think that's starting to improve now, but it seems to me that there has been kind of quite a lot of anxiety around that, and no wonder, because this is we've always said this is life-changing work, haven't we, Sandra? Really?
Absolutely, it is.
And at the moment, that's kind of life-risking work as well. So, and I don't think we ever had that appreciation in quite such a way before.
No, I think people who work in social work and social care have often worked in unrecognised dangerous situations, but this is very different in terms of people just going to their work and running the risk that they could end up losing their life, but that they're willing to keep on doing that. And I think we need to be valuing what that commitment has been. I do worry that almost inevitably the way that the media works is that they look for a story, and there is a bit of a worrying, I think, undertone to the concern about people dying in care homes for older people, as if there was something wrong there, as opposed to this is the almost inevitable outcome of the extremely difficult job that people in the care sector are doing to try and keep those homes going. But infection will spread. Infections do spread, and they always have spread in care homes, not least of all when you've got people with dementia, who it's very difficult to keep socially isolated.
Well, I mean, infection also spreads on cruise ships, but you don't see those people being crucified on the front page of a tabloid, do you?
No.
And I think there is, I think there's a degree of irresponsibility actually at the moment in the commentary about this, and there's a desire to kind of point the finger and to blame people for this, which is absolutely inappropriate, especially at this time, because people are already anxious about going to their work, and to ramp that up even further when they read stories in the papers about this. I just think it's wholly unacceptable, and I do wish there was a bit more kind of challenging of that, shall we say.
I think if you are working in a care home where there is infection and you are taking a risk yourself going into work, but you're doing that, you're coping with substantial numbers of people that you become quite close to with because you work with them day in and day out who are dying. That's difficult enough without then having in the media reports an implication that maybe something is being done badly or wrongly, as opposed to people doing their very best to keep people well and alive in these units.
Well, and something really good that's coming out of this is that's been picked up pretty quickly, and it's been picked up at the right levels. And there's now quite a pretty strong program of support for mental health and well-being amongst care workers. And that's being led by the Minister for Mental Health, and it's quite high priority. So I'm really pleased to see that, because again, you know, like I was saying before, if you can't be rock solid behind your workforce at a time like this, then the whole thing's going to fall apart.
I mean, I think there are other as yet unthought through challenges ahead of us when we begin to come out of it. One of the remarkable things that's happened is we've managed to get people off the streets who are homeless into hotel beds. But there's going to come a day where the issue is going to be, are we then going to say to them, well, you'll need to get out of this hotel because it's going back into business and you'll need to go back to sleeping in the streets? And that doesn't seem to me to be a good solution. If we've managed to build huge new hospital facilities in a matter of days, then surely we can come up with some solutions other than sleeping in shop doorways on streets for the people who we've managed to protect at short notice.
Yeah, well, it goes back to what I was saying before about the value we place both on social care and on the people who are supported by social care.
Absolutely.
And for me, that is kind of top of the list for some serious review when this is done. Yeah,
and hopefully there will be that. So as you say, this has been life-changing. I think it's been life-changing in a very, very short period of time. And whilst there's been a lot of
life-changing for me.
Likewise. And whilst there's been awful things have happened, I think there will be good things come out of it at the end of the day if we sustain that commitment and say, let's not forget the lessons that we've learned. So let's hope together and with our colleagues in the medical field and the health service that we can solve some of those problems that have been structural, that we found difficult to deal with, by realising that when it comes to the crunch, we can make a real difference.
Yep, and you know, some of us have been working for a while on the principle of collaboration rather than competition. You know, multiple agencies rather than specific organisational allegiances. And if ever there was a time to kind of just shrug all of that off and let it go, this is it.
I hope that we will have learned that competition is not the way to improve things, certainly in this sector. But by working together and behaving in ways that are problem solving, then that's what improves things.
I think that you should have the final word on that, Sandy.
Well, I think we have probably run out of our time, Annie. It's been good to talk.
Yep, you too.